Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts and topics on the fields, of nutrition, prevention, integrative, and lifestyle medicine for individuals, society, and the world. So today I'm going to do something a little different that I've never done before, and that's jump across the pond, so to speak, and interview someone who does integrative veterinary medicine, and we'll see what the links are and the similarities, and I'm very interested. So with that said, I'd like to welcome Dr. Angie Stamm. I want to say that right, Stamm. She's a doctor of veterinary medicine, and I believe she went to the same alma mater I did. I didn't go to veterinary school there, but I went to UC Davis. Is that correct?
I did, yeah, for my graduate degree. Yes, I did my undergrad back in New York at Colgate University.
Uh-huh. And then you did the veterinary medicine at UC Davis.
Correct.
Is that correct?
Correct.
Do you mind if I ask how long or when you graduated? How long has it been since you graduated?
I graduated in 2001. So going on 25 years. Yeah.
We were on the campus at the same time. Cool. In fact, I used to go to the veterinary library of medicine, the library at the vet school, every Thursday night for my first business, where I would review all the current stacks. I would flip through the current stacks looking for nutrition and preventive medicine articles. And I did that for probably 10 years because they switched them every Thursday night. So every Thursday night they put up the new stacks. And so before the professors threw them all over the place, I'd go and sneak in there and get the table of contents. All right. Well, good. Nice. So we have that connection.
Nice.
So how did you decide to be a vet? And then how did you decide that you wanted to shift over into, and what do you call it? Holistic, integrative? I don't, whatever term you want.
I'm purely integrative. I do both Western and holistic methods.
So you'd say integrative.
I would say, I call it integrative. Yes.
Got it.
So I was always drawn to medicine. I was always interested in medicine, even as a young girl. And when I went to college, I was actually pre-med, tracking to go to medical school. But I kind of got a little bit disillusioned, to be honest, by there was, maybe it's just where I was, but there seemed to be a lot of people going into human medicine for the wrong reasons, status and sort of not for the love of medicine, the people that I was around. And it seemed to be really competitive and just this kind of competitive environment around status. And I didn't really like that. It felt uncomfortable. And it was my uncle, who was a biologist at the Bureau of Land Management at the time, who suggested, hey, why don't you go to vet school? It's like, I never really thought about that. But I kind of saw it as like maybe a less competitive track and give something that kind of would allow me a little more freedom. I grew up in, my stepfather is an OBGYN doctor. And so I grew up seeing the challenges of the Western medicine world being so riddled with control of HMOs and government and so kind of cool to just practice medicine without the stronghold of government control. It's a cash business. You can switch species. You can do whatever you want.
Let me ask you a question before I forget. You said competitiveness in medical school. UC Davis and vet medicine, I don't know. I mean, I saw a lot of vet students freaking out.
That was a naive statement, because little did I know, actually, vet school is more competitive than medical school, but it didn't feel that way at the time.
Right.
Because I went to a small school, so nobody at my school was trying to go to vet school.
Okay. I just had to clarify that, because, man, I saw a lot of competitive vet.
Yes, technically, there are less spots in vet schools than there are medical schools.
Okay. Keep going.
So, I mean, I went into the field because I like medicine and I'm interested in medicine. And the species was less important. I just, of course I loved animals. I grew up riding horses and we had dogs but it wasn't like this childhood aspiration. Oh my gosh, I really want to be a veterinarian one day. I really like medicine and I want to learn as much as I can about health and healing. And this seemed like a little bit more open path for me to accomplish that, which, looking back, it has been. It's allowed me a lot of freedoms to learn.
How did you start the beginning of the integration? In other words, did you do just one little avenue that interested you, or did you just jump? Or
going into the integrative side, you mean?
Yeah, you started traditionally, right?
Going to the dark side. Actually, I was drawn. I was kind of drawn to the alternative medicine side even before I went to college. I had some chronic headaches from a whiplash injury growing up as a teenager and a horseback riding accident. And got the MRI and the CT scan. They can't, Western medicine didn't really have any answers, of course. So I started seeking out alternatives for my own health at an early age. Found some chiropractors and some structural, functional, posture type people that helped me a lot. And I'm like, oh my gosh, this really opened up my eyes to the fact that Western medicine just doesn't have all the answers that we need, and we need to have other tools in our toolbox. So I kind of figured that out early on. And then when I got to vet school, I started the Integrative Medicine Club there at Davis. We would bring in speakers and we would go to the holistic conferences with the holistic vets.
So you were a leader.
I was a leader to some extent. I mean, it was a small club. It wasn't a big deal, but yeah, we kind of headed an integrative medicine movement, which nowadays at the vet school at Davis, there is an integrative medicine department they offer acupuncture, but they didn't have that 25 years ago. So it was kind of more of a fringe thing back then. And so I started going to the conferences at vet school, learning as much about all the different modalities that I could, and talking to the existing holistic vets that at that time. And, at that time, there weren't really any schools or courses other than acupuncture and chiropractic for vets to learn it. Other than that, it was kind of, you learn through mentorship. So I did my acupuncture training and TCM training at the Chi Institute in Florida, which is a school that trains veterinarians to do acupuncture.
How long have you been practicing before you made that?
Right out of school. I graduated, I started practicing, and I started my acupuncture training. I'm like, I'm going for it. I got to learn this. I'm doing this. I'm so excited. And at the time, I was in a mixed animal practice up in Placerville, California, working on dogs and cats and horses and sheep and goats. So it was rural, and we didn't have a lot of opportunity to practice acupuncture, but I dabbled a little bit. And it wasn't until a little bit later that I joined an integrative practice and started to really hone my skills more.
So did you learn 5-element theory?
Yes. Yes.
So
yeah.
How do you feel for pulses and look at tongues in animals? Is that what is?
You can do that. Yeah, we can do that. I mean, I don't do that as much now. I would say I'm less of a traditional acupuncturist, and I've integrated so many other modalities that I kind of have evolved my own style. But certainly classical acupuncture is tongue and pulse diagnosis, and that's taught on the animal side as well.
So what were the more frequent things that you treated animals for with acupuncture?
Primarily chronic pain, arthritis, back pain, anxiety was a big one. But yeah, it's primarily musculoskeletal, especially with the horses. I worked in a lot with sport horses, and we would do treat for back pain and sport enhancement.
So let's hang on with that for a second. So you've got this horse and they've got back pain. You do some acupuncture. Are you doing manipulation? You haven't learned that yet, right?
At that stage, no.
No. Would you do that now?
I can do, yeah, I do that now. I learned a different technique called VOM using different machine adjusting tool, activator and such.
Mm-hmm.
But I learned acupuncture on horses. One of my mentors was a racetrack vet who did a lot of aquapuncture technique, where he did all injectable acupuncture technique. So injected B12 and saline into the acupoints. Right. Boom, boom, boom. You're done. Peace out. You're not dropping needles all over the haystack and the shavings. And so that was a great thing. But so that's the technique that I sort of carried over into the small animals as well. And I do mostly aquapuncture nowadays.
Did you have to get in like the racehorse situation a quicker response? Acupuncture you can go for once a week or twice a week for 5 weeks, let's say. But in your medicine, did you have to get results more quickly? Does that make sense?
No, we still would, if we're treating an acute condition, we would go weekly for a few treatments, then back off to maintenance frequency. That's still the case, but you can certainly get benefit from one treatment.
Okay. So while we're on pain, what other modalities do you use on animals for pain? And then tell me, I know this may sound simple, but how do you know the animal's out of pain?
Well, of course, they can't tell you, right? So that's a little more challenging. They can't tell you where it hurts. So that's always trickier. In horses, we can diagnose lameness using nerve blocks. So we start at the distal limb. We block out with lidocaine the nerves that innervate the distal part of the limb, the hoof, for example, see if they go sound. If that doesn't work, you keep going up sequentially up the limb until you block out the lameness, and that's how you localize lameness in the sport horse. In dogs and cats, that's not really done. So it's done more about palpation and x-ray findings. Sometimes it's hard to figure out. But if they're not limping and they're in pain because of back pain, then usually they will have kind of a hunched posture. If it's their neck, they hold their head down really low and they won't move their neck. They won't want to jump up on furniture. It's hard to jump up in the car. Those sorts of signs are what we look at. And if they're in severe pain, they won't eat, they'll hide, they'll just not move.
So what other modalities will you use for pain in, let's say our dogs and cats, the old animal gets hip arthritis, and it's trialing around acupuncture.
So
What else might?
if it's just hip arthritis, the way I would approach it is kind of a tier depending on the client's motivation, the pain severity. It's nice when you have so many tools, but really you have to kind of get a sense of where the owner wants to go with it. What are their belief systems, right? Some of them just want Western pain meds. They just want their NSAIDs, peace out. They want to go away and they don't want to, but if they don't want to just put the animal on pain meds, which is always my preference, then I try to use the pain meds as a last resort and then go down sequentially in order of priority. Top priority is looking at the diet and making sure the animal's on an anti-inflammatory diet. We can talk more in depth.
Let's do it.
So anti-inflammatory diet would be number one, removing the processed food from the diet. So anything in a can or a bag that's high heat processed, which is going to create the heterocyclic amines, the oxidative stress. Usually the kibble-based foods are very high in carbohydrates, which are not biologically appropriate. And a lot of times, even like the more traditional kibbles contain GMO-heavy grains, corn and wheat, which are high in glyphosate. So that all adds up to a lot of oxidative stress and leaky gut, and that translates into joint pain, as you know from your human practice, same thing. So getting them off of the kibble, whether it's a cat or a dog, is really foundational if the owner can budget that. It's more expensive, certainly, to do a fresh diet, but that's really the key because
fresh diet meaning you're making it, or
there's different ways. So that's one option: home cooked, commercial frozen, fresh or raw, commercial freeze dried raw, or a hybrid where a lot of companies have a premix where you can add your own fresh meat and then it has the veggies, maybe dehydrated veggies and vitamins and minerals that balance out the meat. So there's a different.
What would be a simple home anti-inflammatory meal for your dog that has hip dysplasia?
I mean, I'm not a big recipe person. I feel like recipes are very restricted and we should have variety, but you can get imbalances over time if you just feed one diet, and I don't think that's good for the body either. But for example, if you did, I don't like to use a lot of carbohydrates because we have a lot of obesity problems and cancer problems in pets. So what I would probably feed as a, short term, knowing this is an imbalanced diet, is some fresh meat, whether it's beef, turkey, chicken, and maybe some non-starchy vegetables, cauliflower, broccoli, green beans, some bone broth, some sardines, some eggs, a little bit of fresh veggies, something like that. And that's not balanced. You've got to get the mineral balance right. But that would be okay to feed short term.
Well, that would seem like it's very similar to the humans if you were going on an anti-inflammatory diet. Now, that diet, if you kept it on, might slide into ketosis, correct? I mean, if you were just meat and non-starchy vegetables.
Correct.
How do you tell if an animal's in ketosis? Or do
Um,
you?
you can't, I mean, other than checking their urine or their blood,
Right,
but you can buy the ketone urine strips and check pretty easily.
right.
And I think ketosis is a great tool for animals, just like it is for people for, cancer support and weight loss and diabetes management, all those things. So that's a tool that we can use. So anyway, yeah, going back to the chronic pain, the diet's the foundation. I can do all this great acupuncture, but if they're eating a processed diet, inflammatory diet, it's not going to work as well, just like you and your practice.
So you've got acupuncture, you've got diet, maybe another modality or two that are your favorite, and then what supplements would you use for pain?
Chiropractic is pretty foundational for chronic pain management. Pretty much all animals as they get older have back pain, just like us. And so chiropractic, various forms of chiropractic can be really, really just profoundly helpful. And it's not that expensive. It's super safe, and it doesn't have to be done that often. They can come in quarterly for some chiro, and it just makes such a big difference in these old animals' mobility. Even if they have peripheral joint arthritis, usually their backs and their necks hurt too from compensating. So just starting there and with the diet can be a big thing, a big improvement. The other, go ahead.
No, I'm just saying that then do you see the animal prance in? I mean, like move easier, obviously.
Yeah, you get treatment and then they run out of there and the owner's like, oh my gosh, they're moving better already. You can see it right away.
How rewarding. See,
it's so
I mean, like,
it's so fun.
that must
They
be
come
great.
in and they're like hunched over and they're like, ow, my back hurts. And then you work on them and they're like, oh, I feel better. And they like wag their tail and they eat their treat. Yeah.
Well, like, we talked about, I think in one sense your medicine's more honest. And that's in that if the animal does something, it's not because you suggested it. It's not because I don't know, maybe they are trying to please their owner, but not, it's because they feel better.
They come back for their 1 week follow-up and the owner's like, oh my gosh, got on the couch for the first time in months. Right. So it's pretty rewarding. That's really fun. Back pain is my favorite thing to treat because it's so easy and so rewarding. And we're not just giving Band-Aids by using pharmaceuticals.
It's also some of that. Are animals more sedentary, like the home ones, like a dog and a cat, and because that's one thing that back pain is because one reason you're not moving. We're sitting around all day long, or
it really depends. There's such a variation in pets. Their lifestyles are all different. A lot of them get lots of exercise. So, but it's just normal wear and tear. Some of them are really overactive, and the owners kind of overwork them with repetitive things like for facing, and that can be hard on their body. Or if they live in a house with stairs and they're a little dog or high furniture, all that repetitive jumping and stairs is really hard on their back and their neck.
How about supplements?
Supplements.
Your favorites?
I love fish oil. I'm a huge omega-3 fan. For Colorado State actually just recently has a fish oil dosing chart that you can look up for canine osteoarthritis. And the dose of the EPA DHA dose is quite high. It's a lot higher than you would think. So like, for example, a big dog, say like a big lab would probably take, I don't know, 3 or 4 teaspoons of fish oil a day to really get that omega-3 level up and get the inflammation down. So some animals don't tolerate that much fish oil. They can have, if they have issues with fat metabolism, like pancreatitis or obesity, and they have metabolic syndrome, they just can't tolerate.
So does an animal not care the fishy taste?
Some of them will eat it just fine, but there are some that won't eat it. And then you have to do like the capsules or, some of them just, it doesn't work for everyone, but the vast majority of dogs, and I would say a good majority of cats, will readily eat fish oils. If it's a good quality fish oil and it's not oxidized and it tastes clean, then they'll eat it.
So we got fish oil. What else?
Fish oil. I am a big fan of injectable PS gags. So this
Help
is
me with that one. I don't know. I'm not familiar.
So in this country, they're not approved for humans, but in other countries, you can get injectable glucosamine type derivatives
Got it. Okay.
that are more bioavailable than oral. So we use those quite often in the animal world. So you can do your oral glucosamine, MSM, HA, but you're limited to oral bioavailability, and sometimes animals won't eat them well. So we have products called Adequan, on the canine and equine side, which is a bovine cartilage derivative that's injected under the skin or into the muscle. You do a loading series, and then you do it once a month for maintenance. And it's not really a pain, supplement, but it's marketed like a pharmaceutical, but it's really not a pharmaceutical. It's a nutraceutical. It's injected. So there's really low side effect, and it's really profoundly helpful. And the cost to the client, it's really good bang for your buck, because the cost to the client is really lower than, once you're on maintenance, lower than what you'd pay for a good quality oral joint supplement. So I use a lot of those. And I use one off label for dogs. It's actually labeled for horses, and it's called Zycosan is the brand, and Pentosan is the drug name. You can get this in Australia for people under the brand of Cartrophin. So I can't say that I may or may not have tried it on myself, but anyway, so injectable PS gags are great, along with high dose fish oil and some body work and the anti-inflammatory.
When you say PS gags, you mean glucosamine,
polysulfated glycosaminoglycans. Right. So those are glucosamine family. So that high dose fish oil, anti-inflammatory diet, and some body work, and a lot of times you don't even need NSAIDs or pain meds.
Animals good to go.
Yeah, good to go. And some,
you know what? So my guess would be also, you always hear about dermatologic conditions in animals. So if you got them on an anti-inflammatory diet and gave them fish oil, their skin might improve, no?
Oh yeah, huge. I use fish oil a lot for allergies and itching, right. And yeah. Oh yeah. If you have them on anti-inflammatory diet and fish oil, you can see across a room which animal's on kibble versus which animal's on a fresh diet.
Their coat.
They've got kibble bloat, they're bloated, they're overweight, they're dull. And you can see after a month the difference. Yeah.
Yeah. Kibble's probably not one of your advertisers, huh?
No. I mean, sometimes you have to use kibble because of budget reasons, and that's fine. There's some good quality ones out there, but just do what works for your budget. Maybe aim for 50% kibble, 50% fresh, or whatever, whatever's going to work. It doesn't work for everybody, but I mean, I sometimes feed kibble to my dogs, but I try to do.
I have to ask this question because I always think about it, but does the pet mirror what their owner looks like in body type?
Oh yeah, and they have, through the quantum field, similar disease processes too.
Okay. Now, is
you
that
know about that?
Yeah. All right.
That's weird. That's weird that my cat's hyperthyroid because I'm hyperthyroid.
All right. So we went through pain pretty well. So we can cover maybe two other areas of interest. Is cancer an interest of yours or no?
Yeah.
Or what's your next fun one?
Chronic pain is my favorite to treat because it generally, is pretty easy and affordable to treat. We see a lot of allergies in pets. That's probably my least favorite because that's hardest to treat. It's so multifactorial, and it's there's so much environmental toxins that it's really hard to fully get those animals allergy free. So allergies are hard. Cancer is really, really pervasive in the animal world. 1 in 3 pets are now getting cancer. And so it's a big problem. So cancer is a whole rabbit hole, right? But we do treat a lot of cancer from an integrative standpoint. Again, I start with the foundational, which is the anti-inflammatory diet, and reducing their vaccine load, reducing their insecticide load. We use lots of different herbs and nutraceuticals. We use functional mushrooms. We use ozone therapy, IV vitamin C.
I have a question. I shared that with somebody about IVs, and they said, is the animal sedated when you give vitamin C? No. You just how do you keep them still?
So, you and I spoke about the humans getting IV vitamin C and how it can be limited by budgetary and time constraints. And that's kind of the same thing with the dogs and cats too, right? Like there's a cost and a time factor associated with it. And we've got to put the IV catheter in. And yeah, we sometimes use oral sedation. But it's like if you're going to have to sedate an animal once or twice a week for IV vitamin C ongoing, that's a lot, right? So there's just some pets that maybe aren't the best candidates for that therapy. So we try to pick and choose what modality is going to work best for that patient's temperament and the owner's budget and time constraints. So
How long would how in an IV, like I'm curious to keep an animal still,
right,
human sit in a recliner chair, so it's not that tough.
right,
Okay. And the
sure,
short one would be a half hour. A long one, might be an hour and a half, 2 hours.
exactly.
So how does an animal sit quietly for 15 minutes?
Yeah, it's hard. So I mean, if they're an easygoing animal, they'll often just chill in a cage, and we can watch them in our treatment room, and just kind of keep an eye on them. If the owner wants to be present, we put them in an exam room and like nice comfy bed on the floor, and the owner can help to manage them during their drip.
I always also wonder, I used to have a pet, but I don't have one anymore. But like, how, let's say an animal's got cancer. Um, I mean, did a lot of people just pull out the stops and say we're just going to do it or did they say this is how much I can spend? And I know it's probably a mixed bag, but
Yeah, it's a
uh,
mix. I would say that, there's always something that they can do, whether it's just a diet change and some oral supplements at home, and that even that alone can really help, right? Some of them will get Western chemotherapy or radiation oncology in combination with the integrative modalities, and so those dogs and cats can do great if they get kind of the combo. Um, but yeah, there's a big range, right? It just really comes down to budget, although more and more pet owners are getting insurance, and then that really helps us with having a little more freedom.
I mean, I was just thinking, we were made fun of when we gave ivermectin to human beings, saying it was horse paste, i.e., that's a therapy for cancer.
Yeah.
So it's right up your guy's alley. It's like,
Yeah, yeah, and I'm getting a lot of clients coming to me and asking for fenbendazole and ivermectin protocols for their pets, and
yeah,
well, they're really just not well established yet in pets, so we have to extrapolate from the humans. But like you and I have talked about, I mean, they're pretty safe. So why not? If your animal's terminal, and in my opinion, my whole thing is do no harm. And if they're not harmful and we could potentially help that pet, I have no issue doing it.
yeah. Well, I can tell you that the human doses. I mean, there's no huge study, but the human doses is 1 milligram per kilogram starting off on a cancer. So I
Right.
start off at a half a milligram per kilogram, and then for the more serious, you try and build up to 2 milligrams per kilogram.
Right.
So that's a
And I think for vets who are wanting to start to utilize those repurposed drugs for cancer, I think the key would be to start out slow and watch for reactions and side effects and build up. Just like you do for people, there is a genetic mutation in certain lines of working dogs, collie lines, called an MDR1 mutation, where they can't metabolize ivermectin or certain other drugs well. So those dogs are going to get more side effects faster.
got it.
Yeah.
Um, how about, are you seeing more how do you tell if a dog has or a pet has a memory issue?
They can have memory issues are harder to define, but certainly cognitive decline is very common, especially dogs, but we see it in cats as well. They usually will kind of like get confused. They'll walk around the house and then get stuck in a room, like, or get stuck in a corner and not be able to figure out how to get out to go to the potty, or they'll just like act confused and spacey, or they'll, like my dog had it. When she's passed away now, but we'd be hanging out and she'd be like laying off, looking in a different direction than what everybody else is doing, just like checked out, you know? So they just kind of lose their interactive capabilities and get disoriented. They can get sundowners just like people. So the symptoms can get worse at night. Those dogs can get anxiety issues as the sun goes down. They become more anxious. They'll pace at night. That's another sign. Anxiety at nighttime can be another symptom, or difficulty sleeping. Nighttime restlessness can be brain aging
Would
changes.
would you say, is there an acceleration of memory issues in animals, or there's it's always been there? There's no difference. Like we see kind of more of an acceleration in the human species of dementia occurring, and we can think of all kinds of environmental reasons. But
Yeah,
it,
I would say from my anecdotal experience, it's probably increased, but not profoundly.
Right.
I think they just don't live as long as we do, so we don't,
Sure.
but yeah, it's definitely increased over my career, I would say.
Do you have any little pearls that you use with memory for animals, or it's not a
Yeah, I do. I have some protocols. Ketogenic diets and MCT is a good place to start, getting them off the kibble, right? There's lion's mane mushroom can work really well. We have a product that we like by Aduco called Myco Neuro. That's a human product as well. It's a combination of brain glandular, buckwheat, turmeric, and lion's mane. So synergy of the antioxidants, the functional mushrooms, and the glandulars. That can work pretty well. There's some choline-based supplements. One's called Senalife for pets that can work somewhat. So, it's hard because cognitive decline is multifactorial, but, choline, MCT, fish oil, the diet. Sometimes there's a factor of blindness or hearing loss playing into that. Those lack of neural inputs from those senses can really exacerbate those symptoms, and that's harder to treat when you have that going on.
Is there any tests that you do for toxicity in animals? Like, we have heavy metal toxicity and we can do chelation challenges, or we can do urinary mycotoxins for mold. But I mean,
Yeah.
animals are eating things all over the place. It seemed like they could get in trouble pretty easy.
Yeah, and I would probably send people ARL, Analytical Research Labs does the hair mineral analysis testing.
Oh, it does.
Yeah, and they do that for pets too. So you can send in a hair sample for a sample. The problem with the heavy metal testing for pets is that, interpretation is tricky and it takes a long time to get good at. And then putting together protocols for pets can get complicated. Most pet owners are not going to do a complicated protocol. But if people want to do that, I would refer them to Dr. Ava Frick. She's kind of the pioneer of hair mineral testing, heavy metal testing in pets, and she's very good at putting together those detox protocols. And it's something that she's done for decades. So, not my wheelhouse, but I knew who to send them to. And I do believe that metals are a big problem. It's just that, the money and the effort and the number of products and the retesting is just not usually economically viable for these pets. So I try to just look at it more from how can we avoid as many toxins going in as we can and control other pieces, right? But yeah, I think it's a problem. I just don't do them a lot just because it's not always practical financially.
Do you see animals eat more junk food? I mean, as people are driving through drive-throughs, or is that not something that's a concern?
Yeah, I think it really depends on your demographic, but I do have one client in particular that I know feeds her dog fast food multiple times a day, and the dog's extremely obese. Puppuccinos from Starbucks, but at our practice, puppuccinos, which is just dairy, right? Whipped cream. So it really depends on the demographic area. We're blessed in Folsom, California, that a lot of our clients are very health conscious and for themselves, and so they don't tend to do that. But I'm sure it's an issue. I'm sure it's an issue among different locations. Yeah.
Let's talk about vaccines, since they're such a nice topic.
Yeah.
And you always thought of animals getting vaccines and not even thinking about harm. It's just like, oh yeah, they're going to get their whatever, and
Right. They need their vaccines, so
I don't know.
They need to have
Give me
their
your 2 cents on vaccines.
Well, certainly the vaccine industry in veterinary medicine is much more focused on disease prevention and not so focused on profits as it is in the human side. So, like I know the childhood immunization vaccine recommendations are up to 42 right now, or something like that, or more.
It's 88 to,
Just
to over 100 especially if they throw in the mRNA. And Dr. McCullough was showing his in 62. It was like 6 when I was hanging out and getting my vaccines.
Yeah,
And
it's really tragic. But so we don't have that problem in veterinary medicine, but we certainly do have there's a legally required rabies vaccine for all animals. And that's fair because that's zoonotic and it's fatal and it's around. We have it. But even that one, so rabies is really the only one that's legally required. There are potential for exemptions with that. If you have an animal that with a severe, vaccine history, reaction history, a chronic disease, anything like that, we can potentially do exemptions. For the other core vaccines, distemper parvo for dogs and the upper respiratory vaccine for cats, once they have their initial kitten or puppy series, you can actually start to run titers for those on an every 3-year basis and see. Usually those viral vaccines are lasting 5 to 7 years, if not their whole life. And so you can kind of get away with just, doing some initial puppy or kitten vaccines and then doing titers, except for the legal requirements moving forward. There are some non-core vaccines that we administer based on exposure risk, and those would be like Bordetella, which is kennel cough, or leptospirosis, which is actually a bacterial disease that's zoonotic. That's in the Western community. Leptospirosis is now being considered a core vaccine and being recommended for all dogs, regardless of their exposure risk or health status, which is a little bit concerning for me because we see a lot of reactions to bacterins. So I use that one with caution, and I don't stack it with any other vaccines. Autoimmune hemolytic anemia and autoimmune thrombocytopenia are real and possible vaccine reactions that we see.
tell me, because I want to get you out of here because I messed up your day by being the wrong time. Let's pull it together with is there an anti-aging movement for animals? Or is
Absolutely.
it
Absolutely. Karen Becker and Rodney Habib wrote the Forever Dog book, and they now have a big online community about longevity. And it's really based on nutrition as the basis, whole food diets. And then from there, they have the fringe of not over vaccinating, not overusing flea chemicals, et cetera, et cetera. So they're kind of one of the big, founders of this movement. But yeah, absolutely. It's a big thing.
do you have a favorite, maybe your top 5 things to do for anti-aging in a dog? Let's take a dog. Anne's best friend.
Yeah. Top 5 would be number 1, get as much fresh food as you can in the diet. So try to follow as much anti-inflammatory, try to use as many anti-inflammatory foods as you can. Number 2 would be exercise. Make sure they're getting adequate exercise. Just like people, right? People don't think about that. I mean, it depends, but make sure they're getting exercise. Number 3, make sure the water quality is good. Making sure you're getting the chlorine, fluoride out of the water, RO filters if you're on city water to get the pharmaceuticals and all those types of residues out. That affects them just like it affects us. Minimize your flea and tick medication exposure. Those are probably one of the more toxic things that we use on them. So if you don't need them, don't just blindly use it every month if you're comfortable with that. And then think about the feeding intervals, right? Don't leave a bowl of kibble out all day for your cat who's an obligate carnivore and it's eating carbs all day long and then getting insulin resistant, right? They should be eating once a day, once they're adults. Even dogs, don't feed them 2 or 3 times a day, unless they have a specific health condition that requires that. Intermittent fasting or just feeding one meal a day is a way better longevity strategy than leaving the bowl of kibble out.
And animals tolerate that. They don't go crazy,
Well, it's
telling you they're hungry all day long.
it's a training issue, and it depends on the animal for sure. But once you get them into that metabolic state where they can do that and they're not they're not reliant on carbs and that insulin response constantly, then yeah, they don't get the food cravings, right? Just like people.
That's great.
Yeah. Yeah. So, and even fast them one day a week, do a bone broth fast or a goat's milk fast one day a week. They don't need to eat every day.
I like your anti-aging thing. That excites me. I think that's cool.
It's practical and it's free. I mean, you don't have to buy fancy supplements. Put the money toward the food, right? Food is medicine.
Got it. Put the money for the food. That's a great line.
Or you buy,
Well,
buy any supplements.
Your clinic's Meridian Meridian Veterinary Care, correct?
Yes.
And tell us where that is and how people can get in contact with you.
That is in Folsom, California, and we do telemedicine appointments as well, or phone appointments for nutrition. Like we can't prescribe pharmaceuticals if we're not physically seeing the pet, but we can do diet and supplement recommendations. And then we also have a podcast that just started called Integrative Connections, and that is where we've interviewed you and some other top health professionals in both the veterinary space and the human space to discuss integrative modalities and health topics for pets and people.
You're going to be a vet for another, how much longer?
I don't know. I'll be 50 this year, so we'll see. I love it, and I do really enjoy it. It's truly my passion, and trying to always learn about the cutting edge techniques and modalities is really what I'm here to do. So I'll be around for a while.
So as we leave, how many practitioners work in your clinic from different disciplines? I think I didn't want to make it think it's just you. I mean, you have a lot of support people. We have
5 veterinarians total and 2 DCs, doctors of chiropractic, that work on animals. And 3 of the veterinarians are acupuncture certified, and have some, we have one that's canine rehabilitation certified, so similar to physical therapy for people. And we have some pretty high level herbologists, herbal medicine doctors as well. So we have a good variety of modalities, and
it's a big clinic.
Yeah, we have a lot going on.
That's good.
Yeah.
That's good. Well, Dr. Stamm, thank you so much. And I apologize again for not looking at the clock right.
Not a problem.
And,
Thanks for having me.
I hope we do this again. So
Definitely.
Thank you very much.
All right. Have a great day.
I want to thank you, the audience, for listening to this edition of the Staying Healthy Today show. And until next time, stay and be well.